Post-traumatic stress disorder, or PTSD, was first listed as a medical diagnosis in 1980. However, it has been recognized and called by many different names throughout history. The first recorded description of PTSD is in the Epic of Gilgamesh, which dates back to 2100 BC. And in the Iliad and the Odyssey, Homer wrote about the Trojan War soldiers exhibiting the symptoms of PTSD. Shakespeare described a character in King Henry IV who suffered from post-traumatic nightmares. During the Civil War, the terms irritable heart and soldier's heart were used to describe PTSD symptoms. In World War I, it was called combat stress or shell shock. In World War II, it became battle fatigue and combat exhaustion. PTSD is not limited to soldiers, as the term concentration camp survivor, survivor syndrome, battered child syndrome, and rape trauma syndrome were all recognized as conditions in the aftermath of World War II. PTSD is a mental health condition resulting from experiencing trauma firsthand or from witnessing others undergoing a severely traumatic event. It can also be a result from repeated exposure to distressing details of an event. For example, many firefighters and other rescue personnel who search for survivors after the 9/11 attacks suffered from PTSD. The traumatic experience can lead to flashbacks or nightmares, which can progress to physical reactions such as rapid heart rate or shaking when reminded of an event. Individuals with PTSD will often avoid any person, place, or activity or object that could trigger memories of the event. As a result, they may feel detached from others or have persistent negative thoughts about themselves or others. They may have difficulty experiencing positive emotions like joy or happiness. Another common symptom of PTSD is hypervigilance and always feeling on guard. This in turn can cause problems such as excessive sleeping, irritability, aggressive behaviors, heightened startle response, or difficulty concentrating. If these symptoms last more than 1 month and interfere with multiple areas of a person's life, then they meet the criteria for the diagnosis of PTSD. PTSD is best treated by psychiatrists and psychotherapists with special training in this area. Treatment often involves a combination of medication and therapy. Support groups, exercise, and mindfulness practices are also healthy coping strategies. And, as with any sickness, compassion from family and friends is crucial. While the name for this illness may have changed, PTSD has been acknowledged for centuries. If you or someone you know is suffering from PTSD, don't wait. Talk to your doctor, counselor, or spiritual leader. For more information, call the Substance Abuse and Mental Health Services Administration National Helpline at 1-800-662-HELP 4357 or text HELP for you 435-748.